Yes, it is safe. Schools have been preparing to have children back. They've been putting in measures such as hand sanitizers in schools, children kept in those bubbles, either a class-sized bubble in primary school or year group bubbles, not mixed in between bubbles. I visited a school in Leicestershire on Friday and I saw the different zones for each of the years and the measures they've put in place in that school, one-way systems. They've had new hand basins put in around the school. The children are all facing the front, they're not breathing on one another. A whole raft of measures, and I think parents can be reassured that schools are adhering to the guidance we issued in July, early July, about how to make schools safe for children. And what the Chief Medical Officer is now saying is that actually the long-term harms to children of not being in school outweigh the small chance of an increase in COVID transmission within the school. School will be mandatory again from September. We live in a country that has compulsory education, and that is right. But of course, fines are available, but they are always used in absolute the last resort by head teachers. And I know head teachers will want to talk to parents that are concerned about their children coming back to school, rather than resorting straight away to such measures. Well, the scientific advice so far is that provided schools put into place the hygiene measures, the social bubble measures, the avoiding these pinch points in corridors, that they have separate entrances and so on, all the measures that can be put in place to minimise the risk of transmission of the virus within the school environment. The advice so far from the scientific advice is that it's not necessary for young people to wear masks in the school. It will be and is compulsory to wear those masks on public transport for children over 11 and on dedicated home to school transport for children over 11. Well, if children are showing any symptoms of coronavirus, then they should go home. They should be encouraged to be tested. And if that test proves positive, then the local health protection teams will advise the school about tracing the contacts of that pupil, either within the bubble or wider in the school community, and then for those young people or adults to also socially isolate.